Hello, I'm Dr. Craig Escude. Welcome to Medical Monday. Polypharmacy. You may have heard that term before, and it really means being on lots of medications, basically. And people with intellectual and developmental disabilities are often on a number of medications, sometimes 10, 12, or more. And with each medication, we increase the risk of adverse effects and we increase the risk of drug interactions. A lot of times these medications are necessary for the person and are helpful to the person. So we don't want to just take everybody off of their medications, but we need to be really careful about what medications we start. We need to evaluate the efficacy of those medications, and we need to take people off of medications that aren't working, or sometimes even give people a trial without being on a medication to see if they do okay without the medication. So I will tell you that signs and symptoms of medication side effects often look very different in people who have trouble communicating verbally. They can't tell you that they're nauseated maybe from the medication. So what happens is they get upset around meal times because they don't want to eat, and they might even become agitated. And sometimes we might see this as an additional aggressive behavior that needs another medication, and we need to use caution in doing this. We need to think about using less medications whenever possible rather than more. So whenever someone is started on a new medication, and this is not just for clinicians, this is any person that helps support people with disabilities, we need to pay really close attention to any changes in that person's behavior, in that person's mental status, in their level of alertness, in their interaction with others, in their overall enjoyment in life activities, because any change like that could be a sign that the medication is having some sort of adverse problem. So whenever someone's started on a medication, everyone who helps support that person should be aware that they're on a new medication and to report any particular changes that they might see, especially in the first 2 to 4 weeks of a person being on a medication. Now, even if they've been on a medication for a long time, but the dose gets increased, for instance. Usually with most medicines, the incidence of side effects can go up as you increase the dose of a medication. So again, you should be extra observant during those times where a medication is increased, a medication dose is increased. And really the same thing when a medication is taken off. Sometimes there may be some good benefits to a particular medication, or we may realize that a person actually gets better when certain medications are taken off because those medication side effects simply weren't really recognized. The person's been on the medicine for a long time and a medication is discontinued and they actually start to do better. I have actually seen people who are on some of the older medications for seizures that were changed to newer medications, and those medications, once reduced, the person actually started talking and communicating and smiling. And that person had been on those medications for years. So these are things we really want to avoid. We want to be really careful. We always want to review medications to make sure that a person still needs those medications, and those should be done on a regular basis. There are clinical pharmacologists and of course physicians as well can help with those things. So take care when people are being started on medications, when the doses are being changed, and also when people are coming off of medications, to look for particular changes that can indicate either that there are adverse effects or good effects to the medications, and make sure to report those with your support team. Thanks for joining me today, and we'll see you again next time.
Hey everybody, thanks for watching this episode of Medical Mondays with Dr. Craig Escude. We got a ton more in the backlog, so if you want to check those out, we got a playlist on YouTube, or you can listen to it on our podcasting platforms. We just want to make a quick note that Friends for Life is currently hiring, so if you'd like to come work with us here at Friends for Life, head over to friendsforliferc.com. Go to our employment page, fill out the form, and we'll get back with you soon. And we also have a new show airing now called Nursing in in no time, kind of as a compliment to these Medical Mondays. So if you'd like to check that out, also available on our YouTube channel. And as always, you guys can check out the Friends for Life podcast and our midweek minis. So thank you for watching. We'll see you next week.